Hi there, welcome to your preoperative journey. So at this point, you have already scheduled your procedure and are anticipating with some level of excitement and also some level of apprehension and anxiety about the upcoming procedure. But I want to help you put it all into perspective, answer as many questions as I can, because it's going to be weeks or months until your procedure. And I know there's a lot going on in your mind. And this entire video set, as well as some of the other information that we have out there, is designed to help you during this entire process and also give you a very clear roadmap about what steps you need to take in preparation. In addition, answer as many questions that do generally come up when patients have asked us in the past. And we want to head those questions off in the past and help you gain knowledge and understanding and get the right expectations going into this super, super exciting, wonderful journey that we're about to take together. Okay, so before we do that, make sure that you have access to your preoperative booklet, as well as the welcome email with all of the various video links and all the other things that are involved that I'll refer to as we get forward. Thanks so much. All right, so what should you be doing between now and your procedure? Now, many times it's months before you have your procedure. You had your consultation. We did a lot of stuff together to prepare for the consultation. We went over everything during the consultation, but now it might be 6 months, 9 months before your actual procedure. There's going to be a lot of confusion about what you need to do and a lot of questions that come up. So one of the things that I put together for us as part of this preoperative journey is a booklet that has lots and lots of information, kind of takes everything through the procedure. That is our preoperative booklet that you can receive via email. Also, it's posted on our website under the preoperative section. That's a fantastic resource, a very up-to-date and current exam. It goes through all the different steps you need to go through. So I want you to have that handy, and I want you to take the time between now and your procedure to really go through that with a fine-tooth comb so you can really become familiar with all the things. And more importantly, so you know where everything is so that when you have a question, you can easily go back to. And use this video that we're doing for the same purposes, as well as another video set that you'll be receiving is the preoperative video with our preoperative specialist, Hillary, who's going to go through step-by-step, all the specific details. But this video that we're doing right now is more of a overall big picture view of the common issues that are going into. So let's talk a little bit about what you need to do to prepare for your procedure. So question that comes up a lot is, should I be doing fillers? Now, if you're going to have a fat transfer with me as part of your procedure, I would absolutely say hold off on the fillers. It's a waste of money for this point because we're going to be going through all the areas that you're going to be normally treating with a fat transfer. Plus, if you have filler in there, it doesn't give me the opportunity to know exactly how much volume to put in there. So I would ask that you hold off on fillers after a fat transfer, you're not going to need it. Now, if you're not getting a fat transfer with me, then you're free to do fillers, etc. I just would say keep it away from the midfacial cheek area, because when we do a procedure like the vertical restore, you're going to be moving so much of this volume back up into the cheeks, you probably won't even need the use of filler. In addition, if you're trying to use filler to quote unquote lift your face, that's a lost cause. Don't even try it. And that'll just muddy the waters for us when we go do our procedures. So generally speaking, fillers is unnecessary to do before your procedure. How about Botox? So Botox is completely okay to do, as you normally would to prevent lines and wrinkles around here in your forehead, etc. Do it in your normal schedule every 3 or 4 months. The only area that I would say hold off on is if you're doing your eyes. If we're doing a lower eyelid skin pinch specifically, or a blepharoplasty, I don't want you doing any in the crow's feet for 2-3 months before the procedure. It's not the end of the world if you go ahead and do it, but it's better to leave that muscle completely intact so that the healing will go a little bit smoother in the postoperative phase and we don't weaken the muscle during the healing process. So Botox is fine. Just be mindful of the crow's feet if you're doing eyes. As far as when to stop it, same concept. Keep going all the way up until the time of surgery according to your schedule. You don't need to make any specific modifications. Another question that comes up a lot is, when should I stop my Retin-A? If you're taking Retin-A and we're going to be doing, say, a laser peel or a chemical peel at the time of your procedure, you can stop it, a week before. I would say in general, a week before is probably a good rule of thumb to stop Retin-A, because you want to give your skin a little bit of a chance to recover from that microexfoliation and all the things that go along with Retin-A beforehand. So think Retin-A, stop it 1 week before. The same goes for hydroquinone. If you're using it to pre-treat your skin before a laser treatment, you want to stop it about a week or so before. So these are common questions that come up a lot for patients. The other aspects are, vitamins and herbs. Now, again, a lot of what I'm talking about is going to be talked about in detail at your preoperative video, but I'm just going to, head off some of these questions right off the bat. If you are used to taking a lot of vitamins, herbal supplements, etc., the rule of thumb is going to be this. You're going to stop all of your vitamins and herbs 2 weeks before the procedure, at which time we will have provided you with a package of vitamins and herbs that you're going to take, ahead of the procedure. So you're going to stop yours and you're going to start ours, and that'll become very clear your pre-op. But think of it as cold turkey on all your normal supplements and fully all in on the ones that we give you. So the other really, really important aspect is this. We could be months away from our procedure. If you have medical conditions, if you have diabetes, if you are a smoker, if you have a heart condition, rheumatoid arthritis, anything that is a notable, a positive on your medical history, this is the time to bring it to our attention. And the reason is, it doesn't necessarily preclude us from being able to move forward with the procedure, but if you do have a cardiac condition, I'm going to ask you to go ahead and get a cardiac clearance from your cardiologist to say, hey, it's okay for you to have a procedure with us under IV sedation, etc. If you have diabetes, I'm going to want to make sure that your diabetes are tightly controlled before your procedure. And if not, I'm going to be able to have an opportunity to discuss with you before the procedure what that means and what the risks of it is and what it's not. If you're a smoker, if you smoke, you need to stop smoking approximately 6 to 8 weeks before surgery. So that means, you got to get ready to stop it, ASAP. If you can't stop, we need to know this because we're going to have to inform you of the increased risks that you're taking by smoking when it comes to things like, the vertical restore, vertical prevent, fat transfer, etc. But also, I'm going to have to modify a little bit of what I do to put you at lower risk if you decide to move forward with it. So these are all really, really important information that we don't want to, find out about 2 weeks before your procedure at the time of your pre-op. So that's a very these medical conditions are really important to bring to our attention, right away. The other kind of general things you got to be prepared for if you are on any type of anticoagulant. Let's say you had a heart stent at some point, or you just take an aspirin every single day. All those things that can make you bleed, the aspirin and those type of things, you need to stop those 2 weeks before surgery. And again, all this will be discussed, but I want you to be prepared for it. So if you have a stent, for example, from a previous cardiac condition, you need to talk to your cardiologist right now to say, is it okay for you to stop for 2 weeks before surgery and 2 weeks after? These are all things we need to prepare for. But again, anything outside of these type of general medical conditions, we're going to totally get you dialed into at the time of your pre-op. And those are the main issues. I would say one other thing that's really important that comes up a lot is a question that comes up is, what do I do if I have fillers everywhere? Do I need to remove these fillers before the procedure? Generally, you don't need to touch the fillers that are in your lips and your cheeks and your temples, all those areas. Because if you try to, it usually causes the tissues to get really weird looking. You get depressions and loss in unusual places, and it can actually make the procedure more difficult for us to perform in a positive way. However, if you have filler under your eyes and we are planning on doing a fat transfer, you definitely need to go in. If you're local, we can do it for you. If you're from out of town, you need to go find a medical spa, a dermatologist, or a plastic surgery office, or whoever can do this for you to put the enzyme hyaluronidase underneath the eyes to remove the filler before your procedure. Typically, you need to do this anywhere from 1 to 3 times, depending on how much filler was put in there and how significantly, how full that area looks and how long you've had it in there. People who've had it in there for a long time sometimes need to put more of the enzyme, more treatments, etc. But we want that area to be basically completely free of filler before we do our fat transfer. And if you don't get it removed, or if you can't remove it fully, a couple of things you need to know to expect is, A, I'm going to be injecting fat through the filler, which is, we have to do because we want you to have that volume, but I may misread how much volume I need to add. But secondly, people who have filler under their eyes and have procedures like fat transfer or even the vertical restore swell up a lot more. They get a lot more puffiness because these fillers absorb a lot of water. So ideally, get all that stuff out of there, beforehand, and don't necessarily do it now if your procedure is, 6 months from now, because you're going to walk around with hollow-looking eyes between now and then. Wait till you get to about 4 to 6 weeks before your procedure. Get this process started so that before it can get removed, and then you go in and we have a procedure to correct it. So many times patients will have it all out and they'll be bummed out that they're looking super hollow and they've got like 9 months to wait before they can get it corrected. So timing is important. Don't rush to do it, but get a plan together to do it appropriately. I think those are the sort of the main things. The big picture is basically between now and the time of your pre-op, there's really not a whole lot you need to do unless you have medical problems and we need to sort that out. But you kind of just take it easy, enjoy your life as normal, do some of the things we said, don't do some of the things we said, and then we'll really, really dial you in for your procedure starting at your pre-op. So we won't leave any stones unturned. You'll feel really ready and really prepared. But take these things that we said to heart. All right, so we're going to go into our next section, which will talk about what to do to prepare for the pre-op in a moment. Okay, so you are now at the stage of your pre-op. We're now anywhere from 2 to 4 weeks before the procedure. You may be out of town, you may be local, and what we're going to do to prepare for the pre-op is a series of reading materials, a series of videos, etc. And I'm going to kind of walk you through each one of those things because the pre-op is a really, really important time. This is the time when you're completely going to focus on how to best prepare for the procedure, all the things that are going to be coming up after the procedure, expectations, etc. is all going to be kind of down on this in this period. Now, it's the rubber is hitting the road. We're a few weeks away from surgery. So here's what happens. So you will have received, if you're from out of town, you will have received a preoperative packet of vitamins and herbs. This is something we want you to take, specifically to optimize your body 2 weeks before surgery, continue taking it 2 weeks after. It's a specially formulated program that helps healing, and it's a phenomenal and fantastic thing. We will provide that for you. What we will ask is that you stop taking all of your normal things and replace everything with this. Again, we'll go through all this at your pre-op specifically, but just be mentally ready for this. We have made a variety of different videos, but the most important ones that you read or you watch before your pre-op is the one that our preoperative specialist, Reily, has prepared. And why that's important is because the pre-op isn't necessarily a time to go through every little detail over again. We want you to come into your pre-op having watched the videos, have your booklet fully read, having all your questions totally prepared so that when you sit down on the phone or in person with Reily or our preoperative specialist, you're going to be completely ready to answer, to have your questions answered, as well as you already have a roadmap of what's happening. So we'll provide you with the video link. We'll provide you with the booklet link. You have to look at all that before your pre-op appointment. That'll make your pre-op go a lot more smooth, and you'll feel like you're going to get a lot more out of it. The other part of the pre-op is we need to get all of your consent forms for the procedure signed and done. You'll be receiving that through an online portal called TouchMD. That'll come to you directly. You can look on that and electronically sign everything. If there's any questions about any of those issues, save those questions for your pre-op meeting, but sign everything, because obviously we can't go forward with any of the surgeries until we have those pieces signed, and we don't want to be chasing you down after the procedure and try to get you to sign things, because if we show up on the day of the procedure and you haven't signed it, we have to cancel the procedure, which is something that neither of us want. So all of those things, the consent forms all need to be signed before the procedure. If there's specific questions, of course, we'll go through them with you beforehand if you need any clarification on anything, but they should be very straightforward. Also, at the time of the pre-op is the time that your payment is due, any other administrative loose ends are taken care of. So the idea is at the pre-op, all your questions get answered, all your consents get filled. You learn the ropes of your booklet and your videos that are at your disposal to help make things good. Your payments are totally taken care of. So from the point of your pre-op going forward, all you have to worry about is totally getting into the zone for your upcoming surgery. That means taking your vitamins when you need to take them. That means getting your mind in the right place, not having a lot of stress involved in trying to complete these things that we just talked about. We want your mind and your body to be totally geared for the procedure. Another really important point is if you're planning on traveling, or even if you're local, you have to make sure you have somebody with you for the first 24 hours after the procedure. If you need help with if you need us to provide you with references of the different agencies that bring you a caretaker, we can do that for you. We should know this before your pre-op, so these people do get reserved and booked out. So, we should do this ASAP. Or if you're coming in traveling with a friend, make sure that they're with you for the first day or two after the procedure. If you're living in Los Angeles or 2 or 3 hours away, you still need to stay with us for at least the first couple days, because we're going to see you back in the office the next morning after almost every procedure, other than things like fat transfer and eyelids, which we don't need to see you right away. But if you're having a vertical restore or vertical prevent, you're going to need to see us pretty regularly after the procedure. So make sure you have plans to stay with us in the postoperative period, at least for the first day or two. If you live reasonably local, a couple hours away or whatever, Orange County, LA, somewhere around there, you can drive back and forth for your 4th day visit and your 7th day visit. But the next morning visit and the first night after surgery, you should stay here in case there's an issue. We need to be able to see you right away. We don't want you getting on the road and traveling. So those are the main things you need to do to prepare for your pre-op. Again, the preoperative video is a whole separate video with a lot of details that go into it and a whole booklet involved in it. You'll learn everything there is to know about it at that time, but get these pieces in order before that preoperative appointment that you're going to be having with our preoperative specialist. All right, so now we are the day of the surgery. So we've gone through the pre-op, you've done all the things you need to do to prepare for it. Now this is basically the night before and the day of the procedure. So basically what's going to happen is you're going to come in to see us having taken an Ativan an hour or so before your appointment. And as you know, the default approach to most of our surgeries are they're done under IV sedation with local anesthesia. So we're going to talk mainly about that, and I'll give you a couple pointers on the general anesthesia. But again, that's all in the preoperative section. But basically, these are the key points. I want to reiterate: if you are having any type of procedure with us that involves IV sedation, you need to have somebody with you after the procedure. So you have to arrive to the operating room in the morning at a surgical center with that caretaker there, because without evidence that somebody's going to be there picking you up and taking care of you for the first 24 hours, we can't perform the procedure. So make sure you have that person with you. Now, if you're having a fat transfer or eyelid surgery and a fat transfer, you can drive or leave the area with a caretaker. You want to, if you live within a few hours or whatever, you can do that. But if you're having a vertical restore, vertical prevent, and any other combination with those two procedures, you have to stay locally and have somebody with you. Okay, so now I want to talk to you about something that's very important. IV sedation. What does that mean? And why do we do IV sedation versus general anesthesia? So let me just start with that. So we have a fully accredited operating room. We can do general anesthesia, we can do IV sedation with local anesthesia. General anesthesia means you get a tube down your throat, the machine breathes for you, you're completely out. You have an anesthesiologist there doing the general anesthesia. That's the way a lot of different surgeries in the world are performed. A lot of surgeons who do facelifts and these other type of procedures do it under general anesthesia. I have always done these procedures under IV sedation with local anesthesia, starting back in my residency and fellowship days. So for me, it's a very comfortable way of doing these procedures, with the advantage that you don't have to have all of the the grogginess, all of the risks, all the things that are associated with general anesthesia to be able to do this procedure. So for a lot of people, including our anesthesiologists and our medical professionals and our doctors that we do these procedures on, they prefer to do it under IV sedation with local anesthesia. And that is that's a wonderful way to do it, but it's not totally equivalent. So I want to be clear about this. Local anesthesia with IV sedation means that you are exactly that. You are sedated. You are not completely out. So I hear this from patients all the time. They're like, oh, I thought I would be completely out. No, I'm going to make this clear. IV sedation means that you are sedated to a point where you're very comfortable. You're not frightened. You're not scared. Generally speaking, most patients are kind of sleeping through the procedure. But you got two different medicine going through your vein. You have a anxiolytic that's in the benzodiazepine class that is that's Versed, which is commonly known as things like Valium and Ativan. That's given to you through your vein. That's like the main way we're going to keep you relaxed, and we give you as much as it needs to keep you in that nice, comfortable, relaxed state. We're very good at titrating to effect, as they say, just to keep you in a nice, comfortable place. We give you a little bit of fentanyl in the beginning of the procedure. Fentanyl is an opioid. It's like morphine that works together with the Versed to make you more relaxed, more mellow, take away a little bit of the discomfort. Because remember, in order to do this procedure, we have to inject the local anesthesia. So local anesthesia is what makes the procedure painless. When we do these procedures, we don't expect you to have any pain at all during the procedure. But injecting the local anesthesia naturally is going to hurt a little bit. It's just like when you go to the dentist and they have to numb up your tooth before they do their procedure. So think of it in the same kind of category. However, the good news is for most patients, none of that stuff do you remember, because one of the properties of IV sedation is that it gives you amnesia. So many times patients literally don't even remember meeting me the morning of the procedure, and then they don't even remember getting home. It's just like that whole time becomes a big void. That doesn't mean that's necessarily going to happen to you. And some of the things that you should know, if you're somebody who drinks from a glass of wine or two a night, if you take anti-anxiety medicine from time to time, if you take antidepressive medicine, those classes of drugs, alcohol, antidepressants, and anti-anxiety, give you a tolerance to the drugs that we're giving you at the time of your procedure. So you got to remember that there's a balance. We're trying to keep you safe from being able to breathe, being able to maintain your own sort of airway, your own physiology, but also keep you comfortable and relaxed so we can get through the procedure very easily and comfortably. But if you take those things, it might take us a little bit more drugs, a little bit more time to get you to that point, or you might not even ever get to a full-blown sleepy state because you have tolerance to it. And this is important because just because you have a tolerance to it doesn't mean your brain still, your brain has a tolerance. That's how people get overdosed. They need more and more to get to that point, but then they stop breathing. So all of these things are what we know to do to keep you safe during the procedure. We've done thousands of these procedures. We know what we're doing. But at the end of the day, keep in mind, IV sedation is not general anesthesia, but this is the way we do 99.9% of the cases. People, generally speaking, have a very, very comfortable time with it. They love it, and the recovery is a lot easier. So what are the benefits of it at the end of the day? You don't have that fog after surgery. You don't have the nausea, vomiting that generally happens after general anesthesia. And there's all these indirect risks that can happen with general anesthesia, from blood clots to pneumonia to a variety of different drug interactions. All of that stuff is put aside. So it becomes an incredibly safe procedure when you remove that component from what we're actually doing, which is generally speaking a very simple procedure from a surgical point of view. So again, I wanted to really kind of emphasize and paint that picture for you. So let's go through the steps. We're going to ask you to shower, wash your face with antibacterial soap. We're going to ask you to take an Ativan before you arrive. You show up, you're going to be greeted by our nurse. She's going to get your vitals. She's going to put you into your surgical outfit. You're going to take another Ativan. So now you've taken 2 milligrams of Ativan before the procedure, roughly an hour. Then we're going to take your photos. We're going to get an IV. You're going to see me at that point, usually about an hour after you've arrived and you've done all these different things. You're going to see me. That's where I'm going to mark you and do all these different, get you prepared for the actual procedure. And then, of course, if you have any last minute questions, etc., we're going to answer them at that point. That's the kind of the sequence. Then we go into the operating room. We give you this IV sedation through your through your veins. I give the local anesthesia, which is going to make everything numb. We do all of that up front so that you don't continuously feel any discomfort with anesthesia, with local anesthesia. Once that's in, the rest of it's a piece of cake going forward, and it just moves very, very efficiently, very smoothly from that point on. And throughout the procedure, we'll be giving you a little bit more sedation at the safe intervals to keep you comfortable and relaxed throughout the procedure. Those are the basic steps going into it. Now, very quickly, what are you going to expect when you leave the procedure? So again, the beauty of IV sedation is there's no recovery like there is with general anesthesia. You don't need to stick around for an hour or so to let the anesthesia wear off. We titrate it to the point where we time it to where you're done with your last dose, usually about half an hour before you leave. Then we get you cleaned up. Everything is organized. If you're having a vertical restore or vertical prevent, you're going to have a big dressing on. If you're having a vertical restore, you'll have some drains in place. When you leave the procedure, you generally will be pretty lucid, although a little groggy from the Ativan that you took earlier, because that takes about 6 to 8 hours to get out of your system. Pain is usually not a big part of the postoperative experience. Some patients will have some discomfort. We provide you with pain medicine that you can take if you have it. We also provide you with anti-nausea medicine. If you feel any kind of nausea, we want you to take it either right away, or sometimes we'll ask you to take it before your procedure, and this is all in the preoperative section. But when you leave, you're going to have, for vertical restore and prevent, you're going to have external dressing, but also underneath those external dressings is going to be a layer of external sutures that are holding everything down, and that's causing compression and helping decrease the swelling. Those are usually removed anywhere from 1 to 3 days after the procedure, sometimes 4 days depending on what is done at the time of the procedure. But all those are kind of details. I just want you to know what you're going to be expecting as you go forward, as you leave. But for the most part, patients don't have a lot of trouble with that first night. You just need somebody around to kind of be available for you recommend eating a light diet, mostly clear liquids, nothing too heavy. In case you get nauseous, we don't want you to have anything heavy sitting in your stomach. And then that's going to take us to the post-operative day, and we're going to talk about these different post-operative visits in a moment at these specific intervals and what to expect there. All right, so now we are post-operative. We have had our surgery yesterday, and we're in that post-operative phase. So let's talk about what to expect there. So let me start off by sort of painting a big picture. I've put together an entire post-operative team that's going to be taking care of you truly through the entire process. It consists of a nurse practitioner, a medical assistant, various members of our administrative team, every one of them at your disposal to help you through the postoperative process. And it's very, very, like a finely tuned machine. We're always refining our systems to make the experience as smooth and simple as possible. But I want to set you up for success and also for expectations and meet so you know what to expect. So at various points after surgery, who are you going to see? So now you had your procedure, you met the operative crew, that's our scrub tech, our nurse, or sedation nurse, etc. Now we're in the post-op phase. You're going to meet a totally different group of people. The first post-operative visit, day 1 after surgery, and we're talking now specifically for vertical restore, vertical prevent, with any other combination consisting of our facial rejuvenation. If you had eye rejuvenation alone or fat transfer, this doesn't totally apply. You won't see us until day 4. But I'm going to specifically talk about vertical restore appointments, and then we'll talk about what happens at each. So. You're going to come in the office usually sometime in the mid-morning time. You're going to meet any one of these postoperative team members, depending on the schedule and how many other patients are coming in simultaneously. What is going to happen at that appointment is basically to look you over, to make sure that everything looks okay from a postoperative point of view, that there's no signs of hematoma, that the incisions, etc., are intact. They're also really important is to keep the incisions clean. They're going to do a thorough cleaning of all the incision lines. They're going to reiterate the postoperative care that's involved, using hydrogen peroxide and Aquaphor or antibacterial ointment. They're going to go over all this stuff with you. Reiterate how to maintain and take care of drains, etc. This is really a touch point just to make sure that everything looks good and is doing what it needs to do. And it's a relatively short visit. If you're having nausea, etc., they're going to help you with all getting everything organized. They're going to help tee you in. Then what happens? And at this appointment, you usually don't see me. I'm usually at this point in the operating room. As you know, I operate 5 days a week. At this point, I'm in the operating room working on a different surgical patient. And then what happens is you go home, take all the measures that you need to be taking, mostly just relaxing, taking it easy, not doing anything physical, which, by the way, you should not be doing for a minimum of 2 weeks after any of these surgeries. Then on day 4, if you had a vertical restore, you're going to come in and you're going to have your drains removed. Drains are removed on day 4, day 3. I mean, plus or minus a day or two. They'll work with you on specific dates after surgery, but somewhere in that range, you're going to have the drains removed. A lot of patients, think that the drains are uncomfortable or this or that, but they're really, really important because what they do is they create a negative pressure underneath the skin, which causes the skin to collapse onto the underlying tissue and allow everything to heal, and also draw away any fluid, which would then compromise the healing and cause irregularities and increase swelling and all that kind of stuff. So the drain, as much as it is a little bit of a nuisance to have, is a really important part of it. But you can say goodbye to it at this point postoperatively. Again, you're going to come in, you're going to see one of our postoperative team members, and they're going to remove the drain. It's just a simple clipping of a suture and the removal drain. It's not painful, it's not uncomfortable, and most patients consider this kind of a positive step in the right direction as this goes on. If you had eyelid work, you're going to have your eyelid sutures removed at this time as well. Upper eyelids, lower eyelids, all of this is going to be taken out at this appointment time. All of the sutures are taken out by our postoperative team members. And these folks are taking out sutures all day long. They've taken out hundreds, if not thousands of sutures, and you're going to be your best friends in the immediate postoperative phase. And they are a direct link, direct conduit to me. If there's any issues whatsoever, they come to me directly with that information, and we deal with it together. As long as everything is going smoothly and moving in the right direction, they're managing it, but you're always just one step away from me through the postoperative team. Then we get to post-op day 7. This is when the majority of all the sutures get removed. They get removed from the from the ears, from the neck. All those sutures are removed at that point. That's when I come in and give you a thorough look over to make sure everything is healing beautifully. What I'm looking for is, if there's any presence of fluid anywhere, if there's there might be needing a little bit of slight drainage, if there's any signs of infection, how the overall healing is coming along, and we're going to have a nice opportunity to just sort of go over the lay of the land. At this point, you will have noticed that the last day or two you started to heal in the right direction. I'm going to talk to you about stages of healing in a moment, but you're going to notice that things are starting to head in the right direction, typically on the 5th day after surgery, and then by the time we see you on the 7th day. Then there's different appointments. There's going to be a 1-month appointment and a 3-month appointment and a 1-year appointment. You're going to see me at all these different appointment times, a 1 month, 3 months, and a year. If you're from out of town, at the 7-day mark, that's when you're free to go back. And what you're going to do is have a virtual consultation with me on post-op, on the 1 month post-op, 3 month post-op, and beyond. If you're local, we're going to potentially still do this virtually or have you come in, depending on your convenience, etc. But ideally for you to come in and for me to see you in the 1 month and 3 month and 1 year post-ops. So that sort of gives you an idea of what the different points in time are, who's going to see you. Let's take a moment just to talk very briefly about healing and what to expect in the healing phase. So the way all this goes, and I'm going to speak generally about all the procedures we do because they kind of follow the same trend. What happens is healing causes swelling to get worse over a 3 or 4 day period. So you're going to get puffier and more swollen on day 3 and 4 than you were on day 1. So expect that. It's going to look the worst and peak on the 4th. You're going to feel tightness, you're going to feel pressure, you're going to feel distorted, you're going to feel like your cheeks are out to here. All these things are good. Now, my biggest recommendation to you in general is to look at that period and almost laugh at it. Realize that it's a very short-lived period in your healing process. You're going to look great very shortly after. Every single patient has gone through the same process during the healing phases, and you're not going to be an exception to it. But almost no matter how swollen you are or how relatively good you're healing, it's still going to be a lot better very soon. So just know that first week after surgery, the first 3, 4, 5 days after surgery is where you're going to look the most distorted and weird. And there's really nothing that's going to alarm us other than something like that comes very abruptly, like a sudden swelling in your neck or something like that would signify, say, a hematoma or etc. But those are things that we'll talk about, and when to be alarmed, and I'll chat with you in a moment. But other than that, just know you're going to look your worst on those days, and you're going to quickly get better starting on the 5th day and beyond. And then what's going to happen is on between weeks 1 and 2, so day 7 and 14, because we ask all the patients just to take 2 weeks off to recover. Even though some patients you might be looking pretty darn good by 10 days, but it's good to just have a full 2 weeks just to have, because what will happen is you peak around the 4th or 5th day, then you start to go down very, very quickly after that point. And by 2 weeks, you look like yourself for the most part, plus some general swelling. It's not going to look, deformed or weird. You're not going to scare any small children if you go into the supermarket. It's going to be the light at the end of the tunnel. But just know that in 2 weeks, most people get back to work, etc. But at a month, it'll look better than it did at 2 weeks. And at 3 months, it'll look better than it did at a month. And at 6 months, it'll look better than it did at 3 months. And all you're going to hear us say during these postoperative points, and this is really, really important. I want you to take this to heart. Once we've looked you over and we know what normal is and what's not, no matter what is going on, whether you have, more swelling on your right side, whether there's some puffiness in your neck or whatever the situation is, or under your eyes or a bruise here or that, all you're going to hear us say to you over and over again is it's going to take time. Give it time. And we're not saying this just to, kind of brush you off, because the reality is 99.99% of the things that you're going to be experiencing these early stages after surgery will continue to get better for a year, even a year and a half after surgery. So if there's something that doesn't look totally right, all we're going to do is expect time to take care of it. So there's very, very, very few things that are going to require our intervention in the postoperative phase. And if it does, we're going to be all over it like white on rice. We're not going to leave you hanging. We're going to take care of every little thing. But that's going to be to our discretion and our experience, because I know, after seeing thousands of patients over the last 15, 20 years, I know what is normal and what's not. So you got to trust the process. You have to trust my judgment and trust me as I'm taking you through this, to allow the proper amount of time and healing it's going to take to finally get to our absolute end result. And another thing to keep in mind is every single one of those before and afters that you've seen on our website, on our Instagram, and our videos, etc., all of them have gone through exactly what you're going through during this phase. And even though you might think, when you look at some of those healing videos and you're like, wow, that person doesn't look too bad, that's because it's easier to look at somebody from your perspective and say they don't look that bad. But the person who's going through it and they don't look at all like themselves during that healing phase, they consider themselves like they look like an alien. And that's an important perspective to have, because all those pictures that we post of postoperative patients, none of them felt that they looked great for that period of time. They just got better as time went on. And I show that sequencing so you have faith in the process and know that it's going to be coming your way. So healing is a process, but it's always going to be okay, because I can promise you at the time of your surgery, everything is going to be done exactly the same way as I do for every patient. It's always going to end with the same final result. So I want you to really take that part of this message to heart, trusting me, trusting the process. Don't let yourself get anxious. Don't let yourself get too riled up, because the one thing I can tell you from experience is the more emotionally aggravated, scared, anxious you are in the postoperative phase, the longer it will take you to heal. Because your body doesn't do well with a lot of stress and cortisol and all that kind of stuff. It doesn't help move you in the right direction. So take that part into heart, okay? So that kind of gives us a good overview of what's going to happen in the immediate postoperative phases. And the booklet goes through more specifically about what's happening. I'm going to talk a little bit about procedure-specific healing-related issues in a question-answer type of a format in the next segment. All right, so now we're going to talk about procedure-specific expectations and things that come up after surgery. So first procedure we're going to talk about is vertical restore, vertical prevent. That also, by the way, includes neck contouring and lateral brow lift. So all these things are the same. So here's some of the things you're going to absolutely expect after the procedure. So everyone is going to feel numb. 100% of the time you're going to feel numb over the area that we worked on. That goes away typically in 3 to 4 months. Sometimes it takes a little bit longer. Everyone's going to feel tight after surgery. That's normal. It gets better with time. And eventually, by the time it all settles out, it will feel like 100% normal tissue. You won't even know you've had any work done, except for it will look nice and firm and tight, but it won't feel tight. There's always going to be little irregularities in the neck, in the cheek, in the temples, all these things. With time, that all settles down. 100% of the time, it'll all settle down. You'll never have a lump or a bump anywhere in the long run. One of the things that patients get really freaked out about is the swelling over the cheeks makes everything look like an avatar. It gets really puffed out here. That's totally normal. It's because the cheekbone is hard and solid. Any swelling causes the swelling to go outward. Everywhere else is soft tissue. There's a sort of an in and out effect with the swelling, so it doesn't jut out as much. Know that that's normal. It can take weeks for it to completely settle down, but it will totally settle down. As far as incisions and things like that, incisions take up to a year to heal. Some people heal faster. Some people, by the time a month or 2 or 3 rolls around, you can barely see the incisions. Some people, it'll just keep getting better and better as time goes on. But I describe this all very clearly in our booklet. But just know that the most important things you can do to help your incisions heal is keep them out of the sun. The rest of it is part of it's your biology. Obviously a big part of it is what I do surgically, but we kind of share the burden on how the incisions end up healing. But let's just say that 99.9% of the time, the incisions heal really, really well. At the worst, you have like a thin white line where the incisions are. It's never going to be a grotesque, wide, pulled looking scar. So, but you have to be patient with it and be prepared to put a little bit of concealer or tinted sunscreen over it while it's in the healing process. A lot of times patients describe their ears feel weird after a vertical restore, vertical prevent. It's like spots of numbness, a little bit of discomfort, etc. That will all resolve 100% with a little bit of time. That'll all resolve. So those are the sort of main things around vertical restore, vertical prevent. Always looks very beautiful and natural, but gets better over time. Up to a year, you'll still see resolution of swelling taking place. With fat transfer, I want to make a couple basic points. Our goal is never to fill you 100%. So if you're expecting perfection, totally filled, that's not the goal. What we're trying to do is replace some of the lost volume and make it look like it did years ago before you started losing the significant amount of volume loss that comes with aging. But why it's important not to shoot for 100%, because the difference between 105% and 100% is a completely deformed looking face. No one ever at any point in their life looks overfilled, right? I mean, a teenager doesn't look overfilled. A 20-year-old doesn't look overfilled. They look properly. But in fact, by the time you're in your mid-20s and early 30s, you're already slightly underfilled relative to where you were as a teenager. So that's a normal place to be. What I think of it is we're shooting for about 80% correction. If you are really, really focused on trying to get it more full, then you need to go use some postoperative filler to give you that 20 extra percent. But the fat transfer by itself is meant to be slightly underfilled by definition, so we don't run you into problems of being overfilled and deformed looking. So that's a really important point to recognize. The other aspect of this fat transfer, because it's a graft and because it's a living tissue, it will, at first, just like a tree that's been replanted, just like hair transplants, it's going to be a little bit deflated in the beginning. So in the first 1 or 3 months, you might feel like you're a little bit underfilled. But by the time you get to 6 to 9 months, that fat will start activating again, start working again. And what you start to see is an increase in volume in some cases. Now, most patients won't even notice this transition happening. But what we see is that patients that we see at 1 year and 3 years plus after surgery, they look better than they did at 3 months. So that's, it's sort of the gift that keeps on giving. Just know that fat progressively improves, but it doesn't get fuller and fuller to a point where you look bigger and chubbier as time goes on. We never, ever, ever create that type of an outcome to the face. We always want it to look balanced and soft and natural. So that's kind of the expectations with fat transfer. Just know that it's going to get a little bit better and that you don't want it to be completely full. When it comes to the eyes, there's really no issues there. Eyes kind of heal pretty quickly. With lower blepharoplasty, there's some puffiness and swelling in that region that can last up to 6 weeks or so, but it'll really settle down very quickly. Incisions heal really great around the eye. So I would say that's probably going to be the least of your postoperative concerns. Lip lifts, on the other hand, you're going to see some level of swelling and some funny feeling around the mouth for up to 3 to 4 months. I've even seen it last longer. Even though it'll look okay, it'll feel different, but look okay. And you're just going to have to give that process some time. Sometimes the incisions will stay a little bit more red, after the procedure. Just be really good about covering them up with sunscreen, etc. And just know that funny feeling or that movement or immobility, that kind of sensation that you get is because of the swelling. And with time, that'll all go away. But most people, they don't sweat too much about that. They love the look of the lip lift right away. And that just, again, just like the vertical restore and vertical prevent, just takes a little bit of time to get to the final outcome. But just be patient with it and let it do its thing. Sometimes in the beginning, it'll look a little bit over lifted. That settles down too as the swelling relaxes. But the lip lifts, I'm always very conservative with them. I don't overdo them, so they should look really soft and natural when everything settles in. When it comes to the laser, which is the other, from the skin perspective, again, 7 to 10 days, you're going to go over the hump of the healing process with that. 10 to 14 days, things have really, really settled down. You're going to be on Aquaphor for the first 10 days usually, and then after 10 days, you're going to go on Cetaphil. So there's a big breakthrough between day 10 and day 14. Most of the skin is going to be really well healed by that point, with the exception if we go really deep around the upper lip lines, which I sometimes do if you have a lot of vertical lines here. That's going to stay a little bit red longer, but eventually all that settles in. You will not have to worry about having any problems with hypopigmentation, which is like the lightening of the skin or lines of demarcation. That doesn't happen with the erbium YAG laser that we use. Unlike the CO2 laser, which you can have that effect because it's a hotter laser and you're going to stay inflamed for longer. But, with a little bit of oxygenetics makeup, tinted sunscreen, all of that will settle down as well. And with time, your skin will just get better and better and better after the laser. So those are sort of the procedure-specific healing-related issues. I just wanted to give you a heads up so you know what to expect there. All right, so this concludes our perioperative, journey from the time you scheduled your procedure to, some insight into what to expect afterwards. I just want to give you a very, very quick, review of it. You scheduled your procedure with our coordinators. You got yourself ready to go at the time of your pre-op. If you're from out of town, you're always welcome to come in a day early or schedule a Zoom or FaceTime second consultation with me right before the procedure. But for a lot of our out-of-town patients, because of flights, etc., I will see you the day of the procedure or the night of the surgery, and there's nothing wrong with that. I'm completely comfortable working in that type of situation, because that's really when I need to start focusing on you anyway, is right before the procedure. You're going to then do all the things you need to do in your preoperative phases we outlined in this topic here, in this talk here, and ultimately what I want you to walk away from this is, even though this may seem like a little bit of a daunting process, so many of you are so well informed because of all the videos and all the information and before and afters, etc., that we put out there. You know more than most people know about any other surgeon, about any other procedure that they're getting involved in. You really are in a very good position. And really at the end of the day, I want to reassure you that because this is my specialty and I do this day in and day out, there really is not a lot of chance for any type of variation of the outcomes. Every single patient that I operate on ends up with a beautiful, normal, natural looking outcome. We don't have like one good day, one bad day. Everyone's the same. And that should be very reassuring to you as you're anticipating this, and knowing that you're in great hands, experienced hands. We have a phenomenal team. You're going to meet all of them, and you're going to feel very well taken care of and in great service as you go through this process. And we're all one family taking care of you. And ultimately, I want you to approach this time with a lot of excitement and joy, because really what you're having done is an incredible privilege and a beautiful step for yourself. You're taking a great measure to help yourself look as young as you feel, and all the emotional and psychological benefits that come with that. And ultimately, at the end of the day, it's something to really look forward to, and it's going to be a gift that you're going to enjoy for many, many years to come. We got to just get through a week or two of recovery and etc. And then you're off to the races, and you're going to be enjoying the fruits of this entire journey. And we're very, very honored and happy that you have chosen me and my team to take you through this, and we're going to take great care of you and definitely not let you down. So without further ado, enjoy the time between now and the time I meet you. And I look forward to meeting you in person and taking great care of you. Thanks so much.